మీరు కనుక ఫస్ట్ టైం మా ఛానల్ చూస్తున్నట్లయితే లైక్ చేయండి, షేర్ చేయండి, కామెంట్ చేయండి. ప్లీజ్ సబ్స్క్రైబ్. మేము అందించే లేటెస్ట్ వీడియోల నోటిఫికేషన్ కోసం పక్కనే ఉన్న బెల్ బటన్ని ప్రెస్ చేయండి.
Madam, what is sinusitis?
Sinusitis is a common condition seen in our Indian population or outside also, wherein there is inflammation or infection of the paranasal sinuses, leading to nasal congestion, nasal blockade, and nasal discharge.
Madam, what are the paranasal sinusitis?
Paranasal sinuses are basically air-filled cavities which are present on either side of the nose in our skull. So there are 4 sets of sinuses present on each side of the nose: the frontal sinuses, ethmoidal sinuses, the maxillary sinuses, and deep inside are the sphenoid sinuses. The frontal sinuses lie in the forehead region. The ethmoid sinuses are between the eyes. The maxillary sinuses are inside the cheeks, and the sphenoid sinuses are deep inside the skull. So basically these sinuses provide ventilation to the skull and also increase the resonance and improve the quality of our speech. And they also humidify the airway. So when these sinuses, which are lined by epithelium, which secretes mucus, so when there is infection or inflammation, these sinuses get completely filled with fluid or secretions. And when there is blockade of the sinuses, this fluid is unable to drain into the nose. So there will be secondary bacterial infection leading to a condition called sinusitis.
Madam, what are the causes of sinusitis?
There can be several causes of sinusitis, but I'll list a few. Some of them, like if the patient has allergy, so allergens which are present in the atmosphere, like dust, pollen, smoke, certain chemicals, etc., which can lead to some reaction in the body. So these allergens are a common cause of sinusitis. Then those who have a habit of chronic smoking, because smoke itself acts as an irritant, and well, that smoke is inhaled by the person who is smoking actively, or even for the passive smoker, it can lead to chronic irritation of the sinuses, leading to sinusitis. There are some other causes also. For example, simple common cold or rhinitis. So this causes congestion of the nose and leading to blockade of the sinus openings. Once this blockade occurs, then the secretions pool up in the sinuses and there can be secondary bacterial infection leading to sinusitis. Other than that, there are causes such as, for example, some kind of a chronic inflammatory condition of the sinuses which lead to secondary infection and sinusitis. Then reflux, gastroesophageal reflux can also lead to rhinosinusitis, pharyngitis, that is general inflammation of the upper respiratory airway leading to sinusitis. So these are the usual causes of sinusitis.
Okay. Madam, what are the symptoms of sinusitis?
So a patient who presents to the ENT specialist with sinusitis will have these 4 typical symptoms. One is headache. So it can be a one-sided headache, a localized headache, or it can be a generalized headache. So depending on which sinus is infected, for example, if it is the frontal sinusitis, there will be severe frontal headache, and it can be one side or both sides. Then if the patient has ethmoid sinusitis, there will be severe pain between the eyes. Whereas maxillary sinusitis presents with severe pain in the cheeks and in the upper teeth and upper jaw. And sphenoid sinusitis will lead to a headache in the vertex, that is this region. So headache or heaviness of head is the commonest symptom of sinusitis. The second common symptom is nasal discharge. So initially when it is rhinitis stage, it will be watery or just some whitish fluid which is coming out from the nose. But when there is a bacterial sinusitis, it will be usually foul smelling, thick, and yellowish to green in color. And it can be on one side or both the sides depending on which side the sinuses are infected. And the 4th most common symptom will be nose blockade or congestion. So because the sinuses are completely filled with fluid, so the person will not be able to breathe freely from the nose on either one side or both the sides. Then there are other symptoms. For example, because the sinuses are infected, the mucus from the sinus drips into the throat. So that leads to a condition called postnasal drip. So patient will always have some phlegm dripping into the throat and irritation. It may lead to cough or sore throat. Then because the sinuses, the ear, nose, throat are 3 are connected. So sinusitis can also lead to blockade of the ears and some heaviness and pain and resound in the ears. Sometimes even in severe cases, ear discharge. So these are the common symptoms of sinusitis.
Okay, madam, how do we diagnose this condition?
So normally when a patient is presenting with a common cold which is lasting for more than 1 week, or the patient has symptoms of severe headache, fever, nose blockade and thick discharge from the nose, it is always better to consult an ENT surgeon for a proper diagnosis and management. So when the patient comes to us with these presenting symptoms, then we ask the history, whether the patient has any history of allergy or any history of exposure to certain chemicals or pollution, dust, then any exposure to cold air, or having taken any cold food items or some food items which have, which are not suitable to the patient, or the patient has had an exposure of any other previous illness which makes the patient immunocompromised and susceptible to infections, if the patient is a smoker. And also we ask history of any allergy. Then after we have taken a detailed history, then we examine the nose. That is, we do an anterior rhinoscopic examination, posterior rhinoscopy, and then a nasal endoscopy to find out whether there is any thick discharge in the nose, any congestion, any other structural problems. For example, sometimes the patient may have a deviated nasal septum or a turbinate hypertrophy which predisposes to the sinusitis. So we look for such abnormalities. We examine the throat to see if there is any postnasal drip of the mucus into the throat or congestion. We examine the ears to see if there is any congestion of the tympanic membrane, that is the eardrum, to see whether any such complication has happened. So after a detailed examination, and when we are fairly clinically, we are sure that the patient might be having sinusitis, we also examine the facial, we look for any tenderness in the facial region, frontal region, to find out if the patient elicits any pain, etc. Then we subject the patient to either a simple X-ray of the paranasal sinuses if the condition is acute, that is lasting for about 1 to 2 weeks. But if the condition is chronic or the patient is having recurrent attacks of similar complaints, then we order a plain CT scan of the nose and paranasal sinuses. This helps us in diagnosing the condition. So we can find out which sinuses are infected, how severe the disease is there any other associated pathology like any structural abnormality like a deviated nasal septum or polyps, or if there is any turbinate hypertrophy, etc. Or in cases of complication of sinusitis, for example, if the patient has some swelling around the eyes or severe eye pain or some swelling in the cheek region, or there is some pus discharge from the nose or some around from the eye, medial canthus, etc. So any complication of sinusitis, if the patient has severe headache, so we want to know whether the sinusitis has spread intracranially, etc., or is there any frontal abscess or any other such thing can be ruled out by a CT scan. We also order certain blood investigations to find out whether there is any increase in the WBC count or whether the patient suffers from any allergy condition, so any eosinophilia or raised serum Ig levels. Then if the patient is having a predisposing factor like diabetes or chronic renal failure, so we do a blood sugar count, blood sugar test, or to find out the renal parameters which can predispose to this condition. So another point which I missed out in CT scan is fungal sinusitis. So some patients may be severely immunocompromised or they may have underlying allergy, that is rhinonasal allergy. So such patients can also have fungal sinusitis, which is a much more sinister condition of sinusitis. So it can be either black fungus or white fungus, that is aspergillosis or mucormycosis. So that can also be very well diagnosed by a CT scan of the sinuses or an MRI. So these are the usual investigations we order for diagnosing sinusitis.
Okay, madam. What is the medical treatment of sinusitis?
So medical treatment will basically depend on first and foremost, we tell the patient that they should avoid taking the cold food items or certain food items like citrus fruits or something if they are allergic to those. Secondly, we tell them not to be exposed to cold air like air conditioning, etc., or cold blasts of air. Then we tell them to have plenty of fluids because hydration will improve the drainage of the sinuses and clearing up of the infected sinuses. We also tell them to take steam inhalation about twice or thrice a day, and that will also help in clearing up the mucus from the nose if it is thick. Then topical decongestants are also prescribed, which will relieve the airway. That is, it will relieve the symptom of nose blockade and congestion and allow the sinuses to drain, the secretions to drain out clearly. Then in case we suspect a bacterial sinusitis, we give them a good course of antibiotics for 10 days to 2 weeks, depending on what pathogens we expect in the upper airway. Also antihistamines. Antihistamines will prevent the inflammatory response and will also help symptomatically treat the patient, for example, the headache part, then also the congestion, the runny nose, if there's any itching or sneezing, or all these symptoms can be taken care of by decongestants and antihistamines. Then at the same time, if there is any underlying factor, for example, allergy, then we give them, in addition, we give them some intranasal corticosteroids to reduce the allergy and inflammation. And then we call the patient for follow-up after 10 days to 2 weeks to see if there is any improvement in the symptoms. We ask them to take a good nutritious diet also, do plenty of exercise, and then have enough sleep, and also take plenty of water.
Okay.
So these are the medical managements we prescribe for sinusitis.
Okay, madam. Which cases require surgery?
So there are certain very clear-cut indications for surgery in case of sinusitis. Number one is when it becomes a case of chronic sinusitis, more than 3 months, which is not responding to maximum medical management. Second thing is if they're having recurrent episodes of sinusitis, which get cured temporarily with the course of antibiotics and antihistamines, but then they tend to recur repeatedly. And it also affects the patient's lifestyle and, makes it difficult for him to lead a normal, healthy life. Third is severity of the sinusitis. If it is a severe sinusitis leading to some kind of a intracranial or intraorbital complication, for example, if there is severe preseptal cellulitis or some abscess formation, or if there is certain condition like fungal sinusitis, which has no medical treatment, so straight away we go for surgery. Also, if there are some associated structural abnormalities, for example, deviated nasal septum, turbinate hypertrophy, or a lot of polyps which are blocking the airway and preventing drainage of sinuses, so such patients are subjected to surgery.
Madam, can these condition leads to any complications?
Yes, like I mentioned earlier, that if a sinusitis is neglected, it can lead to affectation of the surrounding structures. For example, it can lead to preseptal or orbital cellulitis, that is, the infection from the sinuses can spread to the eye, because the eye and the sinuses are separated by a very thin plate of bone, both medially and inferiorly. So when the sinuses are infected and it is not treated properly, the infection can spread to the eye, leading to certain symptoms, for example, pain in the eye, or forward bulging of the eye, or for example, blurring of vision, or in some cases even decreased vision can be affected due to sinusitis. Secondly, intracranial complications, because the brain is also just above the sinuses, separated by a thin plate of bone, that is the skull base. So if the sinusitis is neglected, especially in cases of polyposis, or if it is fungal sinusitis, then it leads to gradual erosion of the bony plate which separates the brain and the sinuses. And then the infection spreads intracranially. So it can lead to meningitis, it can lead to frontal abscess, such other complications, intracranial complications. So these are the two dangerous complications. Then there are other complications. For example, it can lead to otitis media or suppurative otitis media. That is, if the infection blocks the eustachian tube and spreads to the middle ear. And then again, it can lead to a chronic cough, pharyngitis, etc. So these are the complications of sinusitis.
Okay, madam. How to prevent or control this disease?
So prevention of sinusitis, again, it is like similar to the medical treatment which I said, that the patient should first identify the cause of the sinusitis and then take the proper treatment by an ENT specialist, whether it is medical or surgical, and a strict follow-up is also important. The patient should have a healthy, well-balanced, nutritious diet, then do light exercise, also have adequate sleep. So this improves the immunity, immunity of the person, and helps the person fight against infections. It also the person should also avoid allergens, for example, dust, smoke, pollution, and others, cold blasts of air, or certain food items which the patient is not agreeable to. So the person should avoid these things. And then there are there's some underlying condition like a diabetic or any other immunocompromised conditions, and those conditions also have to be taken care of. So this will lead to prevention of sinusitis in future.
Okay, thank you so much, ma'am.